Hello and welcome to another episode of the SITREP. Today I want to talk about a huge technological change at VA that for veterans like me and many of you is going to make accessing VA healthcare a heck of a lot smoother and potentially play an important role in future claims for VA disability. But before I dive into the details, do me a favor and hit that like button and subscribe, which helps the SITREP in its mission of connecting veterans with the benefits they have earned and deserve. So I don't know about you, but I travel a lot. Though I primarily use VA Boston healthcare system, I've also used VA healthcare in Indiana, Tennessee, North Carolina, Vermont, and a handful of other places. Each time, I've had to answer a boatload of questions. What prescriptions am I on? What disabilities do I have? Which facilities have I been to? And other stuff that I would think a VA doctor would be able to access without having to ask me a single thing. Well, they couldn't, but they soon will. Currently, VA is making moves to rapidly expand a new electronic health record system called the Federal EHR. This means one medical record. No matter which facility you go to, every blood test, every x-ray, every injury, and every illness will be in one location. This includes military records as well. When you separate from service, you'll be able to walk right into a VA hospital and poof, it's all right there. No more having to recite your medications or medical history. No more having to repeat medical testing. None of it. It's essentially like VA is replacing an Etch-a-Sketch with the latest and greatest iPhone. As I said, for veterans like me, this will definitely make using VA healthcare a lot smoother. But the part that really interests me is that the new Federal EHR is going to allow VA to track medical data across the whole system and locate trends in real time. Yes, this will help with research and improving processes and procedures, but it could also help veterans with VA disability claims in two ways. First, all of your medical records will be in one place. No more having to hunt down military records or having to reach out to some clinic in some town somewhere to make sure you have the evidence you need for your claim. Second, with the influx of data, VA will be able to compare veterans' injuries and illnesses, when they served, where they served, and a lot more, which could lead to new presumptive conditions being identified, which would also lead to more veterans getting the care they need and deserve. All in all, the Federal EHR may not seem like an earth-shattering development, but for many of us, this is going to be a much-needed and welcomed improvement. As always, thanks for tuning in. Be sure to hit that like button and subscribe so you don't miss out on future episodes of the SITREP. Hey everyone, connecting with your benefits is our primary mission, and the SITREP offers more options than ever. Subscribe to our email newsletter, subscribe to our podcast, or subscribe here on YouTube. For details and links, check out the description below.